Today, we are going to discuss the pathophysiology of a concussion for the audience of a parent, student athlete, or coach. Some key points is you need to know that a concussion is due to a force being transmitted to the brain. Now, this means that a concussion can occur in the absence of direct trauma to the head, neck, or face. These injuries can occur both at the point of impact or transmission, which is termed coup, or they can occur on the opposite point of impact or transmission, which is termed counter-coup. Concussions can be described as a neurometabolic cascade. Now, you might be asking, what is a neurometabolic cascade? This means that these events from the injury lead to an imbalance of energy, which result in these concussive symptoms. Some of these symptoms might include headache, dizziness, nausea, and potentially vomiting. We are now going to look at what the normal function of the brain is. So there are these nerve cells termed neurons, and these cells that are in the brain, and they function to send coded messages to the next cell in organized manners. Now, what occurs during an injury or a concussion is these communications become interrupted, which leads to decreased blood flow to the brain and increased demand of energy. This all results in the interference of the communication between these cells. So think you are having a conversation with someone and there's a barrier between the two. So the two people cannot effectively communicate with one another, so they cannot perform the task that is needed to be done. Now, in most cases, these concussion symptoms will correct themselves and the student athlete will fully recover. However, once injured, the brain is placed in a very vulnerable position. We want to then ensure that the athlete is removed from participation, since any further trauma or injury can cause more serious damage to the brain. After the injury has occurred, it does take some time for the brain to get back to its normal function. However, this time is different for each individual. So the different rehabilitation or treatment provided is on an individual basis.